My name is Donna Nauman, and I'm here today with Dr. Jason Webbenmeyer. We are here to talk about functional medicine and how to help patients get well. My philosophy is really about hope, helping other people everywhere find hope and healing. I'd like to introduce Dr. Jason Webbenmeyer, who will be discussing today his practice at the Innovative Health Partners. Hi.
Hello, I'm happy to be here.
Yay.
So yeah, no, you hit the nail on the head when it comes to hope. I think that that's something that I hear a lot of patients when they come to me. That's what they say to me. They're like, "Oh, I finally have hope," or "I've rediscovered my hope," because they've been searching for months, for years to figure out the answers or figure out what's wrong with them. Because they get stuck in the status quo of succumbing to the status quo, if you will, of feeling off, not getting answers, and not really know where to go. And so what's beautiful about what you're doing, Donna, is that you are spreading this message, helping people find that there are other answers. So thank you for that. But yeah, so I practice functional medicine, and I have a practice that involves whole body healing. So I look at the physical, I look at the nutritional, and I look at the emotional. For me, what I have found in the last decade of practice is that you can tell patients what to do, and you can tell them everything that they need to know, but you really need to help them discover what's limiting them. And that's really the key component to what true functional medicine is bringing function back into the body, yes, but helping them release the emotional components that are preventing them from maximizing their full potential.
So how did you get started? Like, did you have a moment that just kind of brought you into this kind of, it's different than Western medicine. So how did you get into this?
Yeah, I did. A pivotal moment in my life was when I was in grad school. So I actually went to school to be a chiropractor. So I have my chiropractic doctorate. And when I was in school, I was actually developing my own health issues. So when I was learning to be a healer, I was actually becoming a patient because my health was declining. I started developing GI issues out of nowhere. I started developing really bad anxiety to the point of multiple panic attacks. And I don't know if you've ever had panic attacks, but they're not fun. And I know a lot of people can relate to those. And again, you just feel lost. You don't really know what to do. So I knew though something was wrong. And when I went to my primary care physician to help figure out what was going on, he told me within my 5-minute appointment with him, oh yeah, it sounds like you have IBS and general anxiety. And he handed me a prescription for Prozac. And I remember at that time thinking, this is the best you can do. Okay. I said, I'm going to figure this out myself because I don't think that that's all I can do. So I did what I knew how to do with being a student in chiropractic school. I detoxed, I cleaned up my diet, I got better sleep and things like that. And when I started seeing my health shift and my body change and my brain function and my mood improve, I knew that was going to change the trajectory of how I wanted to practice with my patients. So I started developing that model pretty quickly. And luckily, I was able to, when I started my practice, have that mindset already so that I can infuse that way of thinking into my patients for their healing journey.
That is an awesome story when you think about it. The GI and the anxiety so go together. When the nerves are all out of whack, the stomach often is a reflection of that. What kind of patients do you typically like to serve?
I love patients who are willing to think differently, think bigger about their potential. It's the patients who are willing to do the work, who know that they're going to be an active participant in their health. And again, it's a new paradigm, it's a new way of thinking, but it's counterculture to what we have been conditioned to think, but it's the exact reason why my patients get well, and patients within functional medicine get well because they have a director, they have a guidance of helping them get to that point. So I love patients who are willing to be open-minded, to think differently, to go against the status quo. And so, yeah, my patients that come to me, they fall all along the spectrum of GI issues, mood and mental health issues, people wanting to discover more about the foods that they're eating that are very powerful for making them feel bad or making them feel good. And I do a lot of advanced lab tests. So a lot of patients that come to me are really interested in diving deeper into discovering more about their health and more about their body. And so I think that that's a really big game changer when it comes to discovering more. And so it's really ultimately comes down to the patient who wants to know more and do more for peak performance, because it ultimately comes down to living a fulfilling, purposeful life. And you can't really do that playing small, playing in this old mindset of what healthcare actually is.
Can you tell patients a little bit about why does food have anything to do with our gut?
Yeah. So, food and nutrition is, when you really break it down, it either is going to prevent you from having optimal health or it's going to really promote it. And when we look at so many factors that go into food, it could be the quality of food, it could be our food system here in America, it could be the societal and the cultural way of eating and drinking. So I always try to bring balance. I'm a very social person. I love to have fun. I love eating and trying different foods, but I also know that you have to have that balance. And so a lot of times when people come to work with me, they have an off balanced view or relationship with food. And when we have to discover more about what's causing their health issues, we have to reevaluate and reassess the foods that they're eating, because they could potentially be causing the health issues that they're coming in for. So whether it's a short-term or long-term evaluation of what they're eating, I always say we want to take away what could be the possible cause of the fire in your body, if we're talking about inflammation. So if you're trying to put a fire out, you don't want to keep adding fuel and sticks and things that are going to keep the fire going. You want to take it away and reveal what could possibly be the issue. And a lot of times when you do that, you start discovering more about, hey, my brain works better, my anxiety is going down, because food is very powerful in that way. And what's cool about that is that you can then tailor a personalized plan moving forward, saying, all right, we now know that this food your body just doesn't like. Let's figure out how we can reincorporate that in a manner that supports you, because that's really when it comes down to, is making a personalized, individualized plan for someone, no matter if a food is perceived as healthy or not.
So could you speak to which foods seem to be the most inflammatory, or the ones that cause the most distress for the body?
Sure. I think that there's a general rule of thumb that there are a handful of foods that can be potential insults or aggravators for the body. It's going to be things like, cow dairy, gluten, egg for a lot of people, soy-based foods, things like that. So I would say if you're looking for a great place to start, those foods are going to be the typical culprits.
The ones we eat all the time. Right?
The ones and that's a lot of times the reason why we get into that place is because it's the foods that we eat all the time. And a lot of our packaged foods and processed foods have those as ingredients. And it's the tasty foods that we're conditioned to eat, whether it's in celebrations or in moments of, I just need to relax and wind down. We go to those comfort foods. And so those are the culprits. But the cool thing is, with advanced testing, if you really want to know what foods are actually causing issues for my body, you can do food allergy testing, but you can always start by eliminating or discovering more, working with your functional medicine doctor to really figure out if there's a food that is the cause.
So what kind of workup do you do when patients come in to see you?
Workups will vary and they'll look different depending on what you're coming in for. But typically, you're going to spend a good amount of time consulting with me. For me, that's where I get the bulk of my information. So patients will fill out a very extensive intake form with questionnaires, and which I think are very valuable. I think we need to leverage questionnaires in healthcare because it's subjectively telling the doctor what you are experiencing, and then you can determine what part of the body is maybe screaming for help the loudest, depending on how your questionnaire is created. And then the consultation, like I said, gives me more pieces of the puzzle that will allow me to hear your story as a patient, hear what you're concerned about, because it's not just about getting all the information. Information's great, but I want to hear it from your mouth. I want to hear what your stressors are. I want to hear what your life is like. I want to hear what your relationships are like. And that a lot of times gives me more information than that's more diagnostic than just the typical health things that other doctors may be concerned about. And then a workup will involve some kind of exam with blood work, advanced blood work. And then depending on what you're coming in for, we will do some advanced lab testing. So it could be hormone testing, stress, cortisol testing, GI specific testing. It just depends on what the concerns are, or I think the biggest, where the beefiest information can come from.
Wow, those are a lot of testing. So if I came in and I was having a lot of stress, what would doing like a hormone or a cortisol test, like how does that work, and how would it benefit me?
Yeah, so one of the most common tests that I will run for patients will be a stress, cortisol, and comprehensive hormone test. These hormones, you have your major hormones, like the ones that we may not even think about, like thyroid or cortisol or insulin, and then you have your sex hormones, and these are all chemical messengers that are communicating to all different systems in our body. And a lot of times that's a great place to start, because when you really break down the root cause or the root issue of a lot of our health issues, it's going to be stress related, or it's going to be exacerbated by stress. So a great place to start, if you don't know where to start, is by testing your hormones and testing your cortisol. Your cortisol, which is kind of like your gasoline for the day. It's your ability, your body's ability to adapt to your daily stressors. It's your ability to get good quality restorative sleep. So all these things that a lot of us can relate to, and a lot of us are struggling with, a great place to start is testing cortisol and seeing how resilient your body is to your daily stressors. And then not just how resilient you are, but is that the cause of the deeper issues that you're trying to find answers for? So it's an amazing place to start. A very effective way to test your hormones. There's a certain lab I use that you get a kit that you take at home, and so it's an at-home test, super easy to incorporate, and it gives you a lot of great, valuable diagnostic information to tailor a customized plan for the patient.
So when I think about hormones, I kind of think about a female. Is this a test
Yeah.
good for a male as well?
It is. I primarily see female patients, but I have a good handful of men that I will use this test for. And I think there is this misconception that when we talk about hormones, we only think about women's health. And hormones are super important for both men and women. You're going to evaluate them and look at them differently depending on the sex of the person, but it really gives you great information depending on what they're coming in for. So obviously you're going to be looking at and asking different questions, but when it comes to testing hormones, it's definitely a valuable test for both men and women. And I often say, typically it's the men who need it more than the women.
Well, because they're so stressed out on these big stress jobs. and they just kind of hold it all in, and they don't realize like those cortisol and how much damage all that can do over a long
Yeah.
period of time. I think I read somewhere that stress related visits at the office are somewhere between 80 and 90%. So people think they're having headaches or they think they're having stomach problems, but really it's initiated in the stress component first. Would you agree with
You're
that?
right. Oh yeah, definitely. So there was a recent study that I think you're right, like close to like 85 or 90% of doctor's visits are due to some stress related issue, and then like 80% of our chronic lifestyle health conditions are actually exacerbated by stress. So with such high percentages, and knowing this data, why not test your personal cortisol response to stressors? Why not evaluate that? I mean, that's for me a great place to start. If you feel lost, or if you feel like you don't even know where to begin, that's an amazing piece of the puzzle that you can then build upon, is just knowing what your cortisol level is specific to you, because of how high these percentages are of why people go to the doctor.
So you say puzzle, and when I think of a puzzle, I think of a lot of pieces. When
Mm-hmm.
patients are coming in, are we having lots of different pieces that we're kind of integrating together to get them better? What would that approach really look like? Because I think we're used to going to the doctor and talking about our headache and getting
Yeah.
information about a headache and leaving. And you're talking about these puzzle pieces, and maybe speak to
Mm-hmm.
that a little bit, what that means.
Sure. I think it's a great visual for kind of how functional medicine works. A lot of times patients will come to me with pieces already, like they hand me the pieces and they say, I need help. I don't really know what to do with this, right? That's why we go to the doctor. We go to the doctor when we have these lists of symptoms. So if you had to really kind of look at it that way, we look at symptoms as kind of like pieces of the puzzle. Symptoms are going to be a result and sometimes the cause of why we're going to the doctor. But when we have all these symptoms, as a health consumer, we can't really, and I don't expect patients to know how to connect them,
Yeah.
right? So
Yeah.
that's why we typically go to the doctors and say, hey, I've got headaches, I've got low libido, I'm gaining weight, I can't think straight, my concentration's going down, I'm waking up at 4 a.m. every single night, and as a functional medicine doctor, it's my job to take those pieces of the puzzle and curate and design, not only discover what the root cause is, but design a plan that's specific for helping them in today's modern busy life. So it's really just a matter of seeing what pieces of the puzzle the patients come to me with, but then also let's go deeper. Let's do these advanced lab tests. Let's do these questionnaires. I'll do, and I'll discover more pieces of the puzzle with my deep dive consultations. And then a lot of times as we move forward in treatment, it's the treatments and it's the follow-ups that reveal more pieces of the puzzle as you take away the layers of the onion. That's a big analogy that people will use, and that reveals more pieces. So it's really important to have someone that knows what they're doing guide you when these reveal themselves. It's like when I go to my accountant, he knows what he's doing. I trust what he's doing. I have no idea what he's talking
Yeah.
about, but he's looking at my pieces of the puzzle and he's helping me put them together and curate a plan that I trust and value him doing so. So it's the same thing when people go to the doctor. They feel overwhelmed, right? Think about your meetings with your accountant. You feel overwhelmed. You don't even know where to begin. It's a
Or it's a
different
panic
language.
attack waiting to happen right there.
Exactly. And it's a different language that we don't know how to speak. We know how to speak functional medicine and our patients don't.
No.
So we have to teach them and show them this is what your body is telling you, and teach them how to listen to the cues of their body and then help them leverage that and set them up for success. I love my patients, but I'm not creating lifelong patients. I want to set you up so that you are able to feel anchored in listening to the cues of your body and knowing to tap into your own intuition and your own, emotional connection to your physical body so that you know how to, work on that in the future for yourself.
That's very well put. And it sounds like maybe you do not just the functional, but looking kind of at the emotional, the mental things that go along with
Yeah.
being, being sick. Is there something in particular that you do with that?
Yeah. So I think early on, I've always known this about myself. I feel like I'm just been very empathetic, very intuitively sensitive when
Yeah.
it comes to other people. And so I've been able to use that gift in the way that I work with my patients. I know that there is a strong connection with and interplay with our emotions and our physical health, right? No, so long are the days of thinking that we can just tell a patient to eat right and exercise.
Yeah.
That doesn't go well, right? That's an old paradigm. That's an old way of thinking.
Yeah.
We have to figure out and discover more about their individual limitations. And so when we discover and once we discover those, we're able to help them take their blinders off. We're all walking around with blinders, and we can't see our own potential until we have someone come in and say, I see your potential, but we just need to take those blinders down.
That's
And
awesome.
when you start revealing those, then and everyone's emotional component is going to be a little bit different, and how it affects their physical health is going to be a little bit different.
Yeah.
But it really just comes down to helping them discover that. And then there's different emotional release techniques. I've used acupuncture. You can use essential oils.
Oh, I
I
love
have
that.
Yeah, and there's different emotional release techniques. I'll give patients homework, journal prompting questions. The healing codes is a great
Oh, I love that.
tool to use for people who need a little bit deeper emotional release that's tied with their ability to maintain and sustain the treatment plan that we're working on, because it's ultimately about getting them to a point where they can fully heal. If we're really talking about true functional medicine, getting to the root cause, you have to deal with emotions.
Yes,
You
absolutely.
have to.
You mentioned the healing code, and I have been studying that recently. Would you just kind of explain a little bit about how energy? What is energy?
Oh gosh, how much time do we have?
I really like energy because it's the light inside the body, and so just speak to that
mhm.
just a little.
Well, we all are energetic beings, and I think that when we talk about energy, I think there's this idea, there's misconception that's like just woo-woo energy, right? People are like, think about it in a certain way, but we do have an energetic connection this energy flowing through our body. So, I can't dissect the body and show you energy, but I always say, if you're a parent with young ones crawling around the house, what do? You put those little plastic caps on the outlets to prevent their fingers from going in, because why? We have conductive energy traveling through us. And so you can't see it, but it's there. That's the energy I'm talking about. And we're very powerful beings when it comes to that. And so when we do something like the healing codes, or when we're doing things like vagal nerve activation,
Yeah.
and things to help release the emotions from our brain to help balance that stress response, it's all about activating the centers of our brain, like the amygdala, like the limbic system, things like that we won't necessarily get into, but using these tools to create new neural pathways to help us respond to stressors in a different way. And when I talk about these stressors, it could be emotional stressors, right? It could be the emotional stressors attached to food, attached to our husband, our wife, our coworkers, our boss. It doesn't matter. And so it's all about when we get triggered and when we get poked, we have to not only be aware of the things that we get triggered and poked by in life, but we have to be open and let our ego go, and be open to the fact that there's an issue within us that's causing that, and it's not the other person.
Yes.
So when we discover that more about ourselves, then we'll be more open to emotional healing. So it gets, I mean, that's just like the tip of the iceberg
Yeah.
right there. But using tools like the healing codes is a way to tap into that and discover more about how emotional health in our subconscious is preventing you from doing what you're capable of doing. We all have stories and excuses. The subconscious is kind of like our reason why not to
I'm not
machine,
going to do that.
right?
Yeah.
Yeah, it's our reason why not to machine. It'll tell you every reason why you should not do something because our brain doesn't like change. It doesn't like to go against the grain. And so when we tap into our emotions, then that's when true healing actually comes, when you discover more about how stress affects the body and why we don't do things that we should do, right?
Yeah.
I know we should do this, but I just don't. Well, why not? You know, so that's the tip of the iceberg when it comes to emotional work and stress.
So I noticed that you do some group visits and have classes. What is that? Like, tell us a little bit about that.
Right. So I love personally, like I said before, I'm a social person. I love community events. I love just, bringing people together. I feel like there's a very powerful energy that comes with being in communities. And the same goes when it comes to healing. So the group visit model is, it's not necessarily a new model, but it's becoming more, more in our present time. And so I've experimented with group visits in the past. I've really been able to make it work for my patients and my practice, where I bring people together who are dealing with similar health issues, who are going through similar journeys. And the reason why I like that, and almost always, probably always, every time I do that, patients end up loving it. They always come out saying, "Oh my gosh, I wasn't sure what I was going to think about this. I loved hearing that Nancy over here was dealing with the same thing, and Susie over here was struggling with making meals for her family."
Like, I thought I was the only one that had that problem.
Yeah. People think that they're the only ones, they're unicorns, and that they're the only ones going through it. But we're all busy. We all have different things in our life, and so group visits, I think, are a way to come together with like-minded people who you can always learn from.
Yeah.
I mean, how many times have you gone to a group, anything, and you learn something from the person sitting next to you, right? You learn something about yourself.
There's good energy.
Right. And so group visits are a great way to experience the healing, experience, if you will, by surrounding yourself with people who are doing very similar work, who are experiencing similar journeys. So like I said, I'll bring together patients who are going through and are experiencing the same, I guess, topic or same health issue, bring them together. And it's very educational, but also I ultimately want the patients to navigate it. I want to see where they're going, because that's ultimately what it's about. It's not about me. It's not about the information I have to provide. That's the starting point. But where do the patients want to go with this? And that's where the learning comes from, and that's where the healing comes from. And then I've also incorporated and created these online courses to help patients no matter where you are on your journey. I have some patients that maybe they're not ready to work with me from an advanced level, one-on-one, and they're not ready or even know what it's like to go deep. So I have these online courses to really help them discover more about their health and to help shift their mindset a little bit while still healing at the same time. And so we were talking about stress and cortisol testing and hormone testing. I have a course that people are loving about testing their cortisol, testing their hormones, and having so many sessions with me. It's a package, and it really focuses on just basically balancing their hormones, getting them to a starting point of what does hormone testing actually look like, what do you do with that information, and creating a customized treatment plan. And then that's a online course that patients can take advantage of as well, no matter where you are.
Yeah. So do you prescribe medications, or what kind of things do you use to help patients begin to heal along with diet, of course?
Sure. I don't prescribe medication. That's not within my scope of practice, but it's also just not how I want to practice. I chose to go the natural route for a reason. I collaborate and I work with medical doctors all the time who are the prescribing physicians, because I do know and I do believe that medications are necessary at the right time in the right place. But a lot of times my patients are coming to me for the exact opposite. They're tired of being on medication. They're tired of it being the only option. So a lot of what I do plays nice in the sandbox with what they're already doing. So I'll prescribe nutraceuticals and pharmaceutical grade supplements to help change the physiology of what we're working on. So if we're working on gut healing, cortisol balancing, blood sugar issues, sleep issues, then there's lifestyle components that will incorporate food and nutrition that's specific to what you need, but then we'll incorporate and prescribe supplements and nutraceuticals that are very specific to and targeting what you're needing as a patient. So that's what I'll use, is like herbs and homeopathics and natural supplements.
And do you find that very successful?
Oh, 100%. Yeah, I mean, that's when you use nutraceuticals and when you use supplements, you're actually helping the body. I kind of explain them as like personal trainers for the organs and the glands in the body. You're going in telling the body to pick up the pace, to do what it's not, to increase the function of the body. And so using these herbs and these supplements are a great way to do so. And I think there's this misconception that you have to be on these for the rest of your life in order to survive or to maintain what it is that you did. And that's false, right? The whole idea is using them to train and build that function, but along the way, working on and discovering more about the root issue of what got you there in the first place.
Right.
We gotta reverse what got you there in the first place so it doesn't happen again. And it always goes back to listening to the cues of your body, reversing, the mindset of what got you there. Yeah. And so that's what you're doing alongside of the work of the nutraceuticals and the supplements that are specific to that patient.
Do you have a patient, or can you come up with a patient in your mind that you just like a typical patient would look like, what your interventions and what the outcome would look like?
Yeah, so I would say like a typical or ideal patient, I grew up with women. I am one of 4 children, so I have 3 sisters. So I'm the only boy in the family. Lots of aunts, and just so I just tend to gravitate towards helping women because I see and I hear their struggles, right? And in general, I also think that women are the ones that care about health, primarily more than men. That being said, I do see a lot of men, depending on what they're coming in for. So I would say the ideal patient is going to be the woman who has had enough, who, they're tired of being told there's nothing to do. They've hit their limit. A lot of the women who come see me are in transitional stages in their life, whether it's their last kid is graduating from school, or maybe they're changing a job, maybe they just moved. It's a big transition, and with that ruffles up a lot about who they are and what their purpose on this earth is, and they get stuck and they don't really know what fulfills them.
Aww.
Maybe it's a divorce and they're now discovering who they actually are. So those women are a lot of times, they want peak performance, they want to go to the next level, but they just don't know where to begin. and they come and say, all right, I'm ready to take care of myself because I've been a mom and I've been
Been taking care of
uh,
everybody else for a
a
long
boss,
time.
I've been a wife, and I've only taken care of other people. And now I have an opportunity to take care of myself. And that's a very empowering place to be in. And I want to catch people in that place because there's hope, there's empowerment, there's insight to thinking differently about health. And but again, it just goes back to not knowing where to begin, not knowing what to do. And I always say that's okay. Like I don't expect you to know what to do. That's
Your job.
why you feel that's my job. That's
Yeah.
my job to help you uncover that and help you set up a plan to do so. So that's my ideal patient. That's who I love working with. It's a very empowering and fulfilling place for me to be in too, because it fulfills my why. It fulfills my purpose of why I'm here. So it's definitely people who are in this transitional stage who want more out of life, but they just don't know where to go or what to do.
That's awesome.
Yeah.
How do we find you?
Yeah, so you can find me in many different ways now with social media and everything. So my website is innovativehp.com. You can call the office at 314-219-1888. You can follow me on social media, Facebook, it's Dr. Jason Webbenmeyer. And then my Instagram handle is Dr. Jason Webbenmeyer. And then there's a link on my biography in my website to take you to the online courses and group courses that I've talked about before.
Could you just repeat your website one more time? I think
Yeah. So,
sometimes we say it and then they go, oh my God, I gotta find a pencil. Where do I write
no,
that
it's
down?
okay.
So
Yeah,
like one more time
it
is
is.
kind of nice.
And I'll spell it out. How about that?
All right.
It's innovativehp.com. So innovative is INNOVATIVE, HP as in health partners.com.
Yay. Is there anything else that you would like to say regarding for helping patients in general?
Yeah. I always like to reiterate that we all deserve the best. So whatever that means to you, I want people to know that you deserve the best and that you deserve to take care of yourself. And if you don't anchor self-care and take care of yourself now, you're gonna have to be forced to take care of yourself when you're ill. And so it's all about prevention. It's all about honoring and respecting who you are, what you want, and what your true potential is. I think that now, with the pandemic and this shift in healthcare and kind of where the world is going, we're being forced to step up our game.
Yeah.
We're being forced to think differently about our bodies, our minds, and our communities. And it's a really cool place. So I think that, again, shifting our mind of maximizing that place that we're in, and again, honoring and respecting you and knowing that you do deserve, that you are enough and that you're worthy to do this. That is step one in what my message is for my patients, is that you are deserving and you are worthy. So that's all I have to say about that.
I think an addition to that is never give up. Like
never give up.
If I go somewhere and they don't have the answer for me, there's another place to go. And I weigh heavy in the Western medicine until I started really studying the functional world. And I know that there are times that we treat patients and we just don't get them better. And to that I speak, don't give up, because changing your nutrition, adding in some vitamin support, doing some healing code energy work, working with a provider like you, like it's so awesome. Like people don't know how much better they could actually feel. Like they don't even know how bad they feel sometimes. And to that, I just never give up. And find Dr. Jason Webbenmeyer, find innovative health partners. Like do the work and do start to feel better. Thank you so much for being here with us today. The patients so deserve to have you as a provider. And to all of you patients, just never give up. Keep looking. And feel free to join Dr. Jason Webbenmeyer on any of his social media or his webpage. Thank you so much for being here today.
Thank you. I appreciate it so much. This was awesome.
Yeah, this is for you guys.